Dr. Mukherjee, I want to start with New York, the city where you are, your professional choice of work, arguably the global corona capital of the world, more than 11,000 deaths in New York, 34,000 across the United States. What has coronavirus meant for the United States and New York, this open, free society that saw itself as a world superpower at the cutting edge of health and science? Has this been a wake-up call?
Well, of course, it's been a wake-up call. It's been a wake-up call for the entire world, I would say. It is fair to say that New York is, as you very well know, under lockdown, shutdown. For a while, the hospitals were overwhelmed. We are now seeing the peak has now gone down for the last few days of deaths and ICU admissions. So it seems that the worst of the storm may have passed, but again, we're still under lockdown, and there is a very great fear that if we open too quickly, then we will get a second resurgence of the virus, and again, another set of ICU admissions and deaths. As far as a wake-up call, yes, of course, it's been a wake-up call for the entire country. I think in America, the realization that there were fundamental systems that were not working optimally, broken, became obvious. You can liken it to America having a full body CAT scan, the whole American medical system, and in fact, the American economic system having a full body CAT scan. And that CAT scan has revealed some strengths and heroism among people, but has also revealed, like CAT scans do, the malignancies that were hidden, the points of weakness, the vulnerabilities that were hidden. Just to give you some examples of this, one of the wealthiest countries in the world, two things are happening simultaneously. One is that for a while, doctors and nurses couldn't find an N95 respirator, the kind that you use to protect yourself against a virus infection. If you're a doctor or nurse, you couldn't find them. So that shows you one peak or one edge. On the other edge of American innovation, there are now at least a promising-looking drug candidate and very promising-looking antibody combinations, cocktails, that the American scientists, American ingenuity is producing. And in fact, this has been also a wake-up call about how global and how cooperative research can be, and when it's done properly, how quickly you can respond to a pandemic.
I'm going to come to that research in a moment, Dr. Mukherjee, but I want to ask you this question. As I said, the world, especially India, has always looked at America as the global leader in the medical space. Are there any lessons, therefore, that India can learn from the American experience over the last month?
The first and most important lesson is to be prepared. And preparation makes all the difference. We are now, as we analyze the number of days that went by before the United States had a good detection kit. I did a calculation yesterday. You would be shocked at the calculation. The first case was reported in the United States on January 21st. This was in Washington State, near Seattle. The first case was reported in January 21st. The first proper kits for detection weren't really available until the first week of March. So we're talking about 40 days. Now, the virus, all viruses have a number attached to them, which we call R0. R0 is the number of people that you can spread the virus to. Some viruses have an enormous number. Measles is, you spread it to many, many people. Other viruses have a very small R0. It depends, of course, on the community. If you're very close together, the R0 increases. If you're very far apart, the R0 decreases. One of the reasons to keep people under lockdown is to bring the R0 below 1. Sorry. Now, if you just understand, just simple virology 101, as it were, If that number is greater than 1, if you are infecting more than 1 person, then the rise of infections is exponential. You will infect 3 people, 3 will infect 9 people, 9 will infect, 27 and so forth.
Right.
If you calculate R naught, I did this calculation last night, late in while I was finishing up a paper. If you calculate R naught from those 40 days that we didn't have a detection kit, we weren't in quarantine, etc., that number is 1.2 or something to the power of 17.